His name is Dr. Sanjiv Patankar, a premier colon and rectal surgeon, a pioneer in robotic and laparoscopic surgery, and a doctor's doctor, renowned for his expertise in his field, expertise that is second to none.
As a surgeon who takes care of patients with complex colorectal problems such as colon cancer, rectal cancer, inflammatory bowel disease, complex pelvic floor reconstructions, patients who have fistulas between the genital and the colorectal organs that have been treated elsewhere but they have not managed to repair them, then I am the one who is thought of, and so referrals come from various super specialists as well as the primary care physicians.
In treating patients, Dr. Patankar says his ears are just as important as his hands.
Some diseases are so simple to diagnose that just listening to the patient for a few minutes, you can come pretty much with nearly 100% certainty as to what disease they may have. Some patients have more complex problems where my physical examination will clarify the diagnosis. And then we can go into the details and the depths about certain special tests that may be needed. So that's one aspect of my skill sets, which I believe is very important and maybe lacking in some of the practitioners of our trade at this point in time, because they are focused on just the patient's chart and what somebody else has done before. You want to understand the person thoroughly. Thereafter, you need to look at, you need to look at the other medical comorbid factors that may impact the decisions that I make.
Having performed thousands of successful colon and rectal procedures over a career spanning more than 20 years, he's most proud of his reputation and his ability to quickly identify issues affecting his patients.
There are several aspects of skills that a surgeon needs to have. The first and foremost is to look at the whole person. Again, that's one aspect. And I listen to the patients. So, for example, some patients will come and they introduce themselves and then they expect that I have read through their chart and I have formulated an opinion. And then I clarify to them that I don't believe that's the right thing to do, because if I were to do that, then I'm doing the same mistake that has often been done, which is why they have not yet healed. You see, they are carrying a brand of a disease on their forehead. I have hemorrhoids, or I have Crohn's disease, or I have this, you see. So the traditional way that a doctor needs to understand a patient and come to a diagnosis is by listening to him.
The doctor also says that when and if surgery is required, preparation before and after is key.
Let's say somebody needs surgery for colon cancer. Then it's important for us to also understand what their nutritional status is. Do they have risk factors such as are their lungs going to be able to oxygenate the patient well afterwards? Is their heart going to be able to withstand the stress of the surgery? So any abdominal surgery, no matter how minimally invasive it is like preparing for a 5K race. If you prepare yourself well, then you can come out winners. At the very least, you minimize the chances of complications happening, and you can achieve outcomes that then can be considered as far better than the competition or what is even reported in the literature.
Dr. Patankar has been recognized by his peers as one of New Jersey's top doctors, and has also been named Physician of the Year, the result of input from his patients. And in listening to his patients, he also has something intangible.
He cares so much, and so he's for real. You know, he takes his time talking to you, explain everything, and he's so warm. He has such a sweet spirit. He really does, and he's a joy to be around. He really is.
Professionalism, as we like to call it, I think the bedside manner can be learned, but if it comes genuinely from your heart and you develop a rapport with the patient, it is so much natural. And it comes from the classic aspect of respecting the patient, as I said, as one of the most important aspects is you respect the patient and you have empathy with the patient, then the rest comes quite naturally.
It was so wonderful, you know. I mean, before the surgery, after the surgery, come and visit him the same way, never rushing, taking his time, you know, caring about you, you see. And how can you not, you know, trust a doctor like that? I never met anyone like him before. I am so grateful every single day. You know, I get up in the morning, so thank God, because I feel that he did save my life.